All right, everyone. I'm so excited to have Colette Hart here with me today. Hi, Colette. Thank
Hi,
you.
hello. Thank you for having me, Sarah.
Yeah, so I want to just let people watching know that how we met because I think it's pretty cool. So,
Hmm.
Colette and I are both part of this organization called the Medical Trauma Recovery Alliance.
That's it.
And yeah, and so when we all introduced ourselves in the alliance, I was just really drawn to reach out to you, Colette. I was like, I want to know her. And so I reached out to you, and I just want to share with people that our conversations have been really impactful to me.
Hmm.
And I just think you're a lovely person, and I love the work that you're
Oh,
doing.
thank you.
And yeah, and so Colette and I thought, hey, let's share these conversations that we're having with other people because it's good information. So yeah, that's my intro of you, Colette, but I thought you could share a little bit more so people could know more about your work.
So yeah, and one of the things that I've always loved about when Sarah reached out was how we immediately got on. We
Hmm.
shared the same kind of, and we just end up having these conversations that come straight from the heart, and almost like we've been friendly and working professionally together for years, and that's so
Hmm.
valuable to have. So thank you for reaching out in the first place, because this has become a really treasured space for me.
Yeah, thank you.
And yes, as you say, we met on the Medical Trauma Recovery Alliance. I'm from the UK, as you could probably tell from my accent,
Mm,
and I live in Wales, within the UK, and I work as a clinical psychotherapist specialising in medical trauma, and have done for some years. I have a trauma background. I describe myself as a medical trauma survivor,
mhm.
as well as a vicarious medical trauma casualty,
Yeah.
which is really a way of saying on the pathway to being a survivor, but not quite there yet,
Hmm.
from a vicarious perspective. And currently, I work in private practice, but I work mainly on Zoom with clients in throughout the UK as well as in Europe and the US.
Hmm.
So I certified as a specialist medical trauma psychotherapist with a Dr. Florm's certificate in Ohio at Xavier University.
Hmm.
And I work as a group therapist, mentor, and consultant to organisations working with metastatic breast cancer. And I've established educational therapy groups for patients across Wales. So I'm also educational trainer and speaker in medical trauma and trauma-informed care for healthcare clinicians and health boards.
Hmm.
And that's where I am at the moment, and hoping that you and I are going to be doing more of the conversational podcasts as time goes forward.
Yes. And I just want to point something out, Colette, that I think is really important, and that's that you're coming in with all this education, which is great.
Yeah,
And then you're coming in with all this experience of working with people, which is really great. And I think that our lived experiences
absolutely.
just give this deeper level of knowing
Yeah,
that I think is really helpful when we're working with other people who've been through it because we actually know what it feels like in our own bodies
yeah,
to be both the patient experiencing
yeah,
medical trauma, but also the people that are frequently forgotten about are the caregivers.
yeah,
And like how
absolutely.
challenging that is to witness somebody we love so much go through challenging things. And
Yeah,
as we both know with medical trauma, like a big part of it's not only the like thing that happens, right? It's not only the physical thing that happens, but oftentimes it's the relational things that
totally.
happen when we're in our most vulnerable moments. And so to witness that as a caregiver can also be really challenging. There's so many like layers to it, so many pieces to the
Yes.
experience.
Yeah, and I'm very conscious and conscientious about really getting to know my clients
Hmm.
through their lived experience and
Yeah.
how I can relate to that.
Yeah.
And when you speak about being a caregiver as well, when you're watching somebody else go through this and you are affected in a different way, you're trying to be their voice and
Yeah.
you're not being heard on their behalf,
Right.
as well as the patients and clients that we work with whose voices aren't being heard either.
Yeah.
And this is why the lived experience is so vital for me, as it
Mhm.
is for yourself, on really having an understanding of that. And I think sometimes that's overlooked.
Right. Yeah, I agree. It really is. So,
Yeah. So you asked me today to do a little bit of give some little bit of tips and information and help towards medical avoidance. And I'm just wondering if which was
yeah.
where we're avoiding going back into that medical environment. Is that still
Yes.
something that you'd like to address,
Yes,
do you
yes.
think?
And I think number one, like you said, medical avoidance. Number one, I just want to like acknowledge how common it is. So somebody
Mm,
who's watching this who's like, oh, that's the name for me not going in because I'm terrified. So I just want to acknowledge like it's really common. It's like a very
yeah.
common thing that happens when we've experienced like stressful, traumatic situations in medical settings. And what we're going to talk about today is what are some ways to help ourselves and to like prepare our bodies, our nervous systems, our minds to
Mm-hmm.
step back into a medical appointment. And I also want to say, you and I have talked a lot, Colette, about like the body and the nervous system.
Yeah.
And I just want for people that are watching this to hear that it makes a lot of sense that you're wanting to
Yes.
avoid. It makes so much sense because when your nervous system has experienced something that felt very dangerous, it's like, no, don't go back. That's dangerous, right?
Absolutely.
So
Absolutely.
yeah. And so that's why Colette and I thought, okay, this would be a great topic to share with people because these steps may be soothing enough for you to help you step back in to get
Yeah.
the medical care that you need.
And I think, as a definition, and we refer to it within our field as medical avoidance,
Hmm.
but because sometimes it's a conscious and sometimes it could be an unconscious decision to
Hmm.
delay or avoid any medical care, even
Hmm.
if we have a medical need. And as you've pointed out with the nervous system, this behavior can stem from fear of diagnosis or a distrust in the
Hmm.
healthcare system, anxiety about medical procedures, negative experiences. And because our nervous system's been so dysregulated through our medical trauma, our senses and our judgment have been hijacked, basically. And
Hmm.
so, why would we not avoid situations that feel threatening? Because it feels dangerous, and our brain is actually saying to us, this is dangerous, I don't want to go back there, because I have a
Hmm.
nervous system dysregulation.
Yeah.
So, and when you think about sometimes how our nervous system dysregulates, and I know you've mentioned and spoken at length with your community about the importance, and you do a lot of work on nervous system regulation.
Hmm.
Um, when you think about how our threat system works when we feel in danger, which is the fight, flight, freeze, fawn response, that's
Hmm.
often mimicked when we go back into our healthcare system. So if we're feeling as though there's a need to fight because we're in danger, we may be challenging or pushing back against that medical provider.
Hmm.
If we feel we need to flee, we will avoid appointments. If we feel a freeze, we can shut down and not be assertive. And
Hmm.
if we feel we need to fawn, then we people please. And consequently, because our rational brain has been hijacked by our nervous system, we can't function from a place of safety.
Yeah.
And that's why we then get into this loop of backwards and forwards and do we or don't we? And we become a point where we are avoidant, even though we really do need to change that to get into a place of feeling in control of our medical
Yeah.
appointments, in control of what we do when we do it, rather than it controlling us. And
Yeah.
that's where those hints and tips can be really helpful.
Yes, and one thing I want to say for people who maybe they just heard your description of like, fight, flight, freeze, fawn,
Yeah,
I'm hoping that that will help them to like have a little bit of like grace and compassion for themselves because
absolutely. And
a
that's part of what
lot,
I'm going to be saying. Yeah. Yeah.
yes, well, a lot of times when that happens, so we fawn because we're trying to feel safe, and then
Yeah.
we leave the appointment and we're like, what did I just
Why
do?
did
And
I
it can
do
be
that?
so easy
Mm.
to go into a shame spiral, but it's just your nervous system trying to protect you. So I just want people to like hear that, and maybe that can help
Yes,
shift their perspective next time, where instead of berating themselves, which we all
we all
have
do.
done,
Hmm.
right? Maybe it can be like, "Oh, thank you, nervous system, for doing your best to protect me. That was the best that we could do in that moment." And yeah, I think that that's what's,
Absolutely.
yeah.
Absolutely. Because it's important to validate that experience because
Yes.
it's not your fault. Your nervous system is doing what it thinks it should be doing, which is
Yeah.
protecting you.
Yeah.
And so recognizing that, as you've just said, and normalizing it, and that can be done through discussion within this group and this community,
Yeah.
or exploration with other trusted family and friends, professional counseling.
Hmm.
It's really important that that is recognized and normalized and validated
Yes.
before you can move on so that that cycle of shame or blame is broken.
Hmm.
And learning to be compassionate to ourselves can be really hard sometimes, as we would be
Hmm.
to a family or a family member or friend. We would be compassionate towards them, but it's not always easy
Yeah.
to do that to ourselves, be compassionate to ourselves. Um, because by avoiding largely, we're losing that opportunity to take control of our healthcare, as I mentioned before.
Hmm.
And in doing that, we empower ourselves. We
Yes.
take agency and we can advocate. And we can create positive experiences, which is where the healing comes from.
Hmm.
But we have to feel ready to engage with that. And sometimes I think people need time to
Hmm.
feel, to get to that space where they feel ready.
Yes.
So the question being, how can we empower ourselves sometimes to gain back that control? And sometimes it can be as when we're working with our nervous system, as you know, we need to be gentle and we need to be kind and we need to
Hmm.
respect it and we need to hear what it's telling us because it's working for us, even though we feel it's working against us.
Hmm.
And trying to create what I call a toolkit or a kit bag.
Hmm.
Um, can really help us with our own individual unique needs when preparing for any medical scenario.
Yeah.
And I'm sure you've worked a lot with the concept of mindfulness, which is being aware of a moment to moment experience in a clear and balanced way. And when our nervous system is impacted, as you mentioned earlier, where we come out of an appointment and we go, why did I behave like that? Or why did I say that?
Hmm.
It's because we're in that threat mode and we're not
Yes.
in the relaxed, rational thought processing frame of mind where we can be totally present.
Hmm.
We're panicking. And so everybody's very different when they look at what mindful practice they engage in. Somebody that might, for example, breathing and meditation, they take a lot of work and a lot of effort that can be incredibly beneficial and very much recommended, but they're not a quick fix or they're not something that's easy unless you've been doing that for some time.
Hmm.
So sometimes other things that we can invest in that can be quicker mindful practice, which is being in the here and now, are
Hmm.
often using our senses. So something that is visual, something that we can hear, something that we feel, the texture that can be soothing, something that we're, even if you're making a cup of tea or a cup of coffee and you're focusing on the smell, the kettle boiling, you're hearing the water boiling, you're focusing on
Hmm.
the scent of the tea or the taste of it, the way that makes you feel. So you're focusing on the present and not dwelling on the past or ruminating about the future. Does that make sense?
Yes, and you just describing that calmed my body When you were talking about just talking about the tea and the smell, and I'm thinking about the warmth of the mug and the
Yeah.
steam that comes up, and just that alone, I'm not even with a cup of tea, that started to relax my body.
I have a client who has a whole coffee ritual every morning. It's her time. She's created a safe space in her house. She
Mhm.
loves coffee, so she has different types of coffee depending on her mood, where they come from. And it's become a whole ritual with a place for her to sit and watch the garden. And all of that is involving her senses. And it's
Yes.
become, and as you said, just listening to her talking about it makes me want to be there.
Yeah.
It's interesting, and we do we can actually look at things in this toolkit for anything, particularly that is meaning making or
Mm.
evokes nostalgic, happy memories. And
Mhm.
again, smell and odor can evoke memories that can be really, really powerful and are processed in our brain that has the effect of switching that threat system into a more calming feel, which is exactly what you just described.
Mhm.
Um, and positive distraction instead of avoidant behavior is what we are trying to habituate. So to do things, use smells, use rituals, use textures, visual stimulation, whatever that might look like. Because if we continue to avoid, that actually has the effect of keeping our fear and anxiety active.
Mhm.
Whereas if we can find a positive distraction, it can help to dilute that fear, calm the brain, reframe, build confidence. And that's where we start to find that we have better management and better powers of control.
Mhm.
Um, and just thinking about things like, for example, and everybody's very different. So this is again where when you're focusing, as you mentioned earlier in our discussion about the lived experience, one size doesn't fit all.
Mhm.
Somebody could be very active in mindful practice, in certain different mindful techniques, whether that's through yoga, whether that's just sitting with meditation, and somebody else might find that that doesn't help them whatsoever. But a
Mhm.
walk in nature has exactly the same effect for them. Or
Yeah.
even just looking out the window, if they have a garden and seeing the birds and the trees, that can have a similar kind of just calming, soothing effect on the brain. So
Mhm.
some people might use music, some people might have a safe and happy place that they recall from nostalgic memories of childhood or a family holiday they've been on, and
Mhm.
they bring that vision through visualization. They can bring that image of that wonderful place back into their mind. They might have creative tendencies in journaling,
Mhm.
photography, exercise is another. These are all big things, mind, imagery. Um, these are all things that we can pare down so we can use, say, a fragrant shower gel in the mornings that has an effect on our stimulus and effect on our senses. We can pick and choose what we think our bodies need for that day. What scent
Mhm.
would be helpful to me? What scent wouldn't? What reminds me of my experience that I want to forget?
Mhm.
What doesn't remind me and gives me soothing, comforting vibes for the day. And
Mhm.
bringing all of those things together and creating our own toolkit has that effect of allowing us to take some of that control back.
Mhm.
And when we spoke about the dysfunction of our nervous system, it actually has the effect of regulation and allowing us to feel more confident. Does that make sense?
Yeah, it's beautiful. It makes so much sense. And, the thing that's coming up for me too around this is for people listening and watching this, is I want them to hear that these are all going to be helpful. And if you've been avoiding medical care for a while, the first time you step in, it's still most likely going to be uncomfortable.
Yes.
And
Yeah.
that's okay. That's okay.
Yeah.
So, what these things are doing is it's helping to make it a little bit more manageable.
Yeah.
It's becoming more manageable so that you can then have the experience, and then after the experience realize I did that.
Yes.
Right?
Absolutely.
Yes, and so the nervous system is getting that experience like you already said, Colette, of that I thought that was going to kill me, right? I thought that was really
Yeah.
dangerous, but I did it and I'm okay. And so that's why I think, and you may be going into this when you talk more about the
Yeah.
toolkit, but
Yeah.
after you've done this experience, it's so important to celebrate yourself.
Absolutely. Yeah. Yeah.
Yes.
Very much so. Celebrating the wonderful human beings that we are is really, really important when we've achieved something.
Yes.
Because the moment that you have that sense of, actually, I've done this, I've asked a rational question, I've had a rational answer, and that was okay. And yes, I still felt nervous, and yes, I still felt uncomfortable, but that was okay too, because my body is telling me there was a reason for danger, but I've
Hmm.
managed. I've
Hmm.
managed to empower myself enough so that I can cope.
Yeah.
And that can be using the word empower again, but that can be really empowering and really important. And I
Yes.
think going back to, I mean, obviously using some of the mindful and grounding techniques, and grounding, just as a side issue, can be as simple, because grounding is about keeping ourselves in the present still.
Hmm.
And it's about learning simple tricks that help us to keep into that present space.
Hmm.
And when I say into, so we could be sitting in a chair like I am now, and I could have my feet planted on the floor, and part of my back is wedged into the back of the chair, and my bottom's on the seat, and my arms could be here. And you're grounded to that space so
Hmm.
that you don't feel as though you've got this kind of structure that's unsafe underneath you. You
Yeah.
could be looking out of a window and doing what we call 5, 4, 3, 2, 1, which you probably are aware of, where it's like 5 things you can hear, 4 things you can see, 3 things you can touch, 2 things you can feel,
Smell.
1 thing you can, yeah, smell
Yeah.
or taste. Yeah, you're working
Yeah.
through the senses.
Yeah.
And you could even just be in that hospital environment, look out the window, and it's what 5 things can I see? And it switches your
Hmm.
brain immediately to unsafe and safe.
Yes.
And this is where your something like scent article, or even, I have clients that, for example, they might have an oil that they really notice calms them because the smell reminds them of a nostalgic memory as a child.
Hmm.
So they might put a drop of oil on a tissue and tuck it up the sleeve and just smell. Nobody notices. They don't feel self-conscious. They immediately are taken back to that safe place, and they
Hmm.
immediately feel calm. And so if we're in that space where we're using our toolkit, we can also start to do preparation before this appointment that's coming up, or
Hmm.
before we have to go back into our medical environment. And the knowledge that sometimes a lot of us forget that this is actually our appointment.
Hmm.
It belongs to us. It's about us and who we are, and that we are the masters of our own bodies, even though that's been subdued.
Hmm.
So this means that we forget that we have the power in that dynamic and in that relationship. And so if we can plan for that together with our toolkit, that can really help us when it comes to taking control of what happens next.
Hmm.
So, for example, say you have a health condition that is chronic and you do need medical intervention, and you have an appointment coming up with a clinician, and you are naturally feeling all of these fearful thoughts, and you've started to put plans in place. You've started to put a kit bag together. You've started to think about what you might want in that kit bag. And then you know that the appointment's going to be coming up. So how can we get to that appointment in the least stressful way?
Yes.
What transportation do we plan ahead? Reflecting on what triggers we have, writing down what our needs are, within the appointment and communicating this. Or if we don't feel that we are capable of doing that, asking someone to come with us and do that for us. So, for example, if in your previous appointments you might have felt rushed or unheard, it's saying to somebody or writing it down and handing it to somebody, to the clinician, or having a partner or a friend say this for you, something along the lines of, it's important to me that you understand I need more time. I can't feel rushed. If we feel that in the past medical jargon and language is used that we just go straight over our heads, please can you explain in a language I understand? Actually saying, and this can be quite hard, I've experienced medical trauma in the past, but that can also become quite empowering because it promotes self-advocacy and it communicates our needs to people, which is really important.
Yeah,
So,
and it also
yeah,
spreads awareness of medical trauma. So
absolutely.
you're actually helping create a little bit of a ripple effect for the provider to,
Absolutely.
yeah, hear that phrase.
Yeah. And I have a colleague who had to have a second surgery when her first surgery had caused her medical trauma. And she wrote a little card. And before she went in, she gave it to the anaesthetist and the surgeon. And they were reduced to tears by what she'd put on that. And it changed the way she was treated. It was a
Yes.
really pivotal moment for her because she felt seen and she felt heard.
Yeah.
And it changed how her treatment went from that day.
Yeah.
And that was a big transitional shift for her.
Yeah.
But that not everybody is able to do that, you know. So we're talking again about the
Yeah.
uniqueness of us as human beings. And in addition to what I've just said, so being proactive about where the appointment takes place, and this can be quite challenging because not, you know, a lot of us don't actually feel as though we have the right to contribute to that conversation, but we do. You
Yes.
know, so if there are lengthy delays, let someone know you want to wait outside, or you want to go to a quiet room, or you want to wait in the car. Requesting an appointment if it's a possibility that can be early or later in the day when it's a quieter time. Taking something with you to record information. And really important as to what you said about celebration is put something enjoyable in place afterwards. Do something for you that's really special afterwards and that's meaning making, and that you can celebrate what you've achieved because you've achieved something huge.
Yes. 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 I want to pause there because, Colette, I think that a lot of times people downplay how big of a step it is to step back into a system that you are choosing to step back in. You know you want to step back into it to get care. But I don't think everybody understands how big of a step it is, how important it is. A lot of times people are not surrounded by people that are going to celebrate them for that because the people just don't get it.
No.
But find the people that are going to celebrate you, right? You deserve to be celebrated after doing that. Yes, plan something special for yourself. Even if you don't have a lot of time after and you can't do something like go out to your favorite meal or go sit in a beautiful park, at least take a minute
Yes.
to tell yourself, you did an amazing job. I am so
Yeah.
proud of you. That was really hard and you did it. First of all, because you deserve it. But secondly, let your brain, let your full nervous system, let every part of you really recognize and like kind of bask in the fact that you just did this thing.
Yeah.
Because that's going to help you the next time you walk in. Your body is going to remember that. It's going to remember
Absolutely.
that sense of celebration when you've done it.
Totally. And again, that is right there with the nervous system dysregulation and regulation, because that sense of achievement and empowerment and self-celebration. And some people actually don't want to celebrate with others. They'd rather just have their own one-to-one, one-on-one, you know, with myself, and just say, you know what, I have done this. I'm so proud of myself. I deserve to feel this way
Yeah.
because I've managed to achieve something that is really special to me. And
Yes.
that's what's important, that self-compassion that we give ourselves, that we don't often do that very easily, um, and validates our whole process from beginning to end, and where
Yeah.
we've come from, that shift, and where we're going to is really important there.
Yeah.
And as you rightly said, actually, a lot of other people might not get it. So it's
Hmm.
really important, which can cause quite a lot of isolation sometimes with people
Yeah.
that just don't feel understood and
Yeah.
heard. And that's part of the problem going forwards, you know.
It really is. And like that's one of the reasons why I have this community, right? Because we
Yeah.
can celebrate ourselves and each other in this community and other people get it. But also, if somebody's listening and you're not ready to be a part of a community, even, I've got podcasts that, there
Hmm.
are people you can listen to and see like you're not alone. The person that's speaking
Yeah.
on the podcast is someone who would celebrate you. So even imagining
Yes.
that all these other people like Colette, they can imagine that you're celebrating them, that I'm celebrating them,
Yeah.
because we all need that. And you're not alone.
Mm.
I think it's so
Mm.
important for people to hear that. You're not alone. Medical trauma is so incredibly common.
Yes.
I mean, I believe there are millions of people walking around with medical trauma, and the majority of them do not know that medical trauma is a thing. So they just think
Yeah.
they're the only ones. They think there's something wrong with them. And it's like,
Yeah.
you're not alone.
No. And we know that, you know, whether it's through cardiac issues, chronic illness, it might be routine procedures. There are sort of, 30%, 30 to 40% of people who, from clinical evidence-based trials and studies, have expressed that they have been really affected
Yes,
by medical trauma, and whether that's from seeing a loved one, whether that's from their own experience, and that means that how many millions are walking around that don't know why they feel the way they do, but just
exactly.
assume it's their fault, which is
Exactly.
how we often default. Well, it must be me. There's something wrong with
Yeah.
me.
Yeah.
And so, yeah, it's really important that this is normalized,
Yes.
and really paid attention to, and that people are helped, to support themselves,
Yeah.
and that they get the support that they need by more awareness being generated.
Yes. Yeah.
So what I can do, if you would like, is I've been talking sort of through some of the information that as we've gone
Hmm.
through today. I can share that as an attachment for you, so people can just have a look if they want to, just for some more information, because there's
Yes.
resources on the end as well.
Oh, yeah, perfect. No, I can absolutely share those in the community.
Okay, so there's my information on the bottom and references along there as well from Michelle's work and two or three other clinical psychologists and authors
Hmm.
that endorse and research this work too.
Yeah, that's wonderful. Colette, thank you so
Yeah.
much for sharing your time and your expertise. And, it's wonderful during this whole presentation, just listening to you speak about this has been so soothing to me. So I'm hoping that,
I thank you.
yeah, yeah. So I hope that other people that watch this are able to get kind of that same experience of just being soothed, thinking about and hearing you talk about these different things that we can do to soothe ourselves. It's really
Mm.
powerful.
And some things that wouldn't soothe you would really soothe somebody else.
Right.
There are some sounds, for example, that can be quite uh, jarring for some of
Mhm.
us. I had a client once that used to love machinery. The sound of machinery or a brush sweeping or something like that would just be, it would just send her into a complete calm response, whereas everybody else would look at her as if, really? That's just, you know, everybody's different, isn't it? And it's finding,
Yeah.
that's the important thing, is finding, and not to panic if you can't find it,
Yeah.
because there will be something eventually. Sometimes people can be so traumatized they need to find that place again to start from, and that's
Yes.
okay.
Yes. Yes. Yeah. We are all starting from different places, our nervous system being
Absolutely.
in different places. And I think while it can be hard for a lot of people to feel compassion, I think just the tiniest little piece of compassion for yourself and recognizing that every day you're waking up and you're doing your best. And if you're starting this journey of trying to recover and heal, it really is just one little step at a time, one little day at a time. And what happens is you may not even notice the progress that you're making, but then you're
Yeah.
going to look back 6 months, you're going to look back a year, and you're going to realize that things have changed, but you're doing it in
Hmm.
this really gentle, caring way that you almost have to like take a little bit of a longer view to notice, but you'll start to notice like, oh wow, I heard that sound or I smelled that smell that used to trigger me and I would just leave my body. I don't even know where I went. And wow,
Yeah.
I smelled that smell and today I was able to stay with myself and just recognize, oh, that's that smell. And oh, I'm feeling a little bit uncomfortable in my body. So, yeah,
Yes.
it's a journey. It's
Absolutely.
absolutely worth it. It's not necessarily easy, but it's worth it.
It is. It
Yeah.
is. It really is. And we know that healing can take place, and we
Yes.
know that that from something so awful for us, we can develop and progress through post-traumatic growth
Hmm.
into a different person, not a cowed person, but somebody that is still valued and valuable and empowered and feels validated and important again. And that's,
Yes.
you know, that's really where we go with this. That's really what our work is about, and just appreciating that, and can be so, well, that's why I do it. I love the work I do.
Yes. Same. And
Yeah.
interestingly, the community conversation last month was about post-traumatic growth after medical trauma.
Oh, interesting. Oh,
Yes.
wow. Yeah.
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 So if someone is just finishing this video and hearing about that, that
Go to that
we do
one.
have that
Yeah.
video. Yeah, and it's really
That would be
beautiful.
great.
So
Yeah. Good.
thank you,
Thank you.
Colette, for being
Thank you.
here.
Thank you for having me once again. It's been lovely. Thank you. Bye bye.